All right, everybody. So I want to explain the procedure for doing blood typing. Um, First, what you need, I've got this transparency film here, and then get a piece of paper that I've got these cut up here that you can put back behind it because it's really hard to see the results of this like straight on the lab table because blood is dark and so is the lab table. You'll need each of the three reagents, a sterile lancet tip that's still got the cap on it, three toothpicks, and an alcohol swab. First thing we're going to do is prepare our slide. So we're going to divide the slide into three sections. That is not the best Sharpie for showing up on the screen here, but hopefully you can see it enough. I'm going to divide this into A, B, and then RH, which is also known as later was named the D factor. Man, I'm sorry about how hard that is to see. The way that this works is we're going to use these reagents here. This is anti-A, which means it will react with the A antigen on your red blood cells if you have the A antigen. Okay, so just one little drop like that is sufficient. And when you do, please put the caps of these back on tight. Not like overly tight, but don't just like loosely put them on because in some of these we've wasted more than we've used because they didn't put the caps on tight and they spilled them. That second one is anti-B and it's kind of a yellow color. The last one is anti-RH, sometimes called anti-D. It's all the same thing. And that one's clear. So we're blue, yellow, and clear. So we're ready to go with this procedure now. What I then have you do is to sterilize your finger. I like the ring finger myself, and we want to go like right here. Now, do they make a little gun for this that you push the button and it does it? Yes, they do. But for me, the risk of people not unloading the gun and then using the same sterile lancet tip, well, it won't be sterile at that point, for two different people outweighs the difficulty of this part. Okay, I like the fleshy part of this finger. I just push it in until it hurts, keep pushing until it hurts a little more, and then if you get a drop of blood, this is important because you're not going to get blood right away. You got to squeeze it out of there. And we're going to touch just a little bit, or a lot in that case, to the top of each of these spaces here so that we can mix that in with our reagents. I'll take my swab and I wipe the excess blood off, and it should, for the most part, seal at that point. So now we're going to use the toothpicks and we're going to mix each of these, and also don't leave your toothpick laying in the solution there. If you want to set them up maybe like this, because the capillary action of that toothpick will draw the fluid off of the slide and onto the table. And then just mix them up. Now what we're looking for is clumps, because when the antibody, the monoclonal antibody that we're using here, when it reacts with the blood, if your blood cells have these antigens on the surface, you'll see a reaction. So if we've got clumps in A, that means you're A. If we have clumps in B, that means you're B. Clumps in both A and B means you're AB. Clumps in neither of these would mean that you are O, okay, because you have neither of those. Clumps in the RH would indicate that you are RH positive. No clumps in RH would be RH negative. So these will tell you your type. This will tell you if you're positive or negative. Now, you saw I stirred it up once, and then I'm just kind of letting it sit. Now, I don't know if you can tell from that distance there. You may have to zoom in, maybe on the video. This one's already starting to react. Now, I could stir this all day long. It's not going to do anything. Well, it'll dry out, but it's not going to react because I know that my blood type is not A. So let me show you what the reaction would look like. If you have A type blood, you'll see still all that blue, and then there's a bunch of clumps. Boy, you can see this really clumping up now. Okay, my B has clumped up quite a bit. Now, it looks like me stirring it kind of acted like it kind of broke up the clumps, but if you can move this along here, you can see the clumps in there. Now I'll look at my RH factor and look for clumps there too. Boy, howdy, look at that. Look at all those clumps. It's clumping like crazy. Okay, so you can see here that I am positive. Okay, we've got no reaction in A, and you can see little clumps in B. Let me stir it one more time here. Maybe we can see those clumps a little better now. Oh yeah, look at that. So that would mean my type is B positive. Okay. If I had no reaction here, that would be O. If I had reaction in A and B, that would be AB. If I have reaction in A but not in B, that would be A. And this indicates positive or negative. Yeah, boy, look at those clumps right there. Okay, so that is the procedure. What you'll do then with this slide is I'll have a box with a trash bag in it that's got to be biohazard, and we'll put that in there. These guys, and that toothpicks and the bloody swab and all that trash will go in there. Now this guy, I'll have a sharps container back there for you to deposit this lancet tip. But if you saw what I just did, that little ring that's on the side, I stabbed this in there so it makes the tip not exposed there. And that should do it, folks.